I'm a total sucker for warranties. Maybe I shouldn't admit this, but I have nightmares all the time about my iPhone breaking. AppleCare? It helps me sleep better. But here's the thing. When is buying a warranty a smart math decision? Is it ever? Take this laptop. Expensive to replace if it breaks, so should we buy the warranty? Before we can answer questions like this, there are a couple things we need to know. How much does the item cost? How much does the warranty cost? How long does it last, and what does it cover? Hopefully these are questions we're already asking in the store, but is there anything else we need to know? How much is the laptop? How much is the warranty? These are important. But there's another question that's just as important. What are the odds that we'll actually need the warranty? We know how much it costs, but how much is it worth? To answer this, we're going to use something economists call expected value. Here's how it works. Take our $1,200 laptop. If there's a 10% chance that it will break, then the expected value of the warranty is 10% of $1,200, $120. This is how much the warranty is worth to us. If it costs less than this, we should buy it. If it costs more, we shouldn't. Now, this $120 doesn't actually exist. We'll either pay nothing or buy a brand new computer. But since we can't see the future, we're willing to pay a certain $120 now to avoid paying a possible $1,200 later. Let's look at another example. There are multiple versions of the iPod Touch, each with a different price. However, AppleCare costs the same for each. So should we buy it? Well, what are the odds that the iPod will break during its warranty period? Probably pretty low, but let's say they're 20%. Here we have three different expected values for the warranty. According to this, we should buy it for the most expensive iPod. We shouldn't for the least expensive one, and for the middle one, we're indifferent. We don't have a preference either way. Of course, all of this depends on the likelihood that the device will break. And so maybe you're wondering, what are the odds? How do we know? We don't. But you know who does? The computer company. And you can be sure that they're not going to lose money on the deal. They're going to charge more for the warranty than they expect to pay in claims. Sure, some people may end up saving money with the warranty, the same way that some people may end up getting rich in Vegas. But on the whole, a warranty is, by definition, a bad bet for us. You can use expected value for a lot of things. A car warranty, a dishwasher warranty, and health insurance. A warranty for you. Healthcare can be a very sensitive topic and one that doesn't have a simple answer. However, we can begin to explore it using the same method that we used for product warranties, expected value. A heart bypass surgery can cost up to $180,000. But what are the odds that we'll need one? If we're young and healthy, the odds are pretty low. So if insurance is too expensive, we might not buy it. But if we're older, if we smoke, if we had a heart attack, then insurance is worth a lot more, and we should be willing to pay a lot more. But even if we have a 50% chance of needing a bypass, who can afford $90,000 for insurance? Even $10,000 might be too much, but it would still be a bargain, but not to the insurance company. So in order to make a profit, they have a few options. One is to not sell us insurance in the first place or to cancel it. Another option is to not pay for the surgery. A third is, in order to afford the high-risk pool, the insurance company can raise the prices for everyone else. But then the young and the healthy people start to leave, which causes the prices to go up even further. In the United States, approximately 46 million people don't have health insurance. When they get sick, they wait. And when they wait, they get sicker. Eventually, some die, while others go to the emergency room the most expensive place of all. But since they can't pay, hospitals pass the costs onto the insurance companies, who pass them on to their customers, many of whom then cancel or lose their insurance. As you can imagine, this is a complicated issue, but at its heart, it's just warranties for people. Now, this analogy isn't perfect. If your computer breaks and you don't have a warranty, it's a bummer, but it's not the end of the world. But if you break and don't have insurance, the bills could be so expensive that you might never be able to pay them. Also, we've simplified things a lot. On one hand, health insurance like AppleCare can help us sleep at night. On the other hand, insurance doesn't necessarily cover everything. So what is the solution? This isn't an equation. There's no clear answer. One option is to require insurance companies to cover everyone and to require everyone to buy insurance. Some people would pay more, some people would pay less, but everyone would have it. Another is to do what Switzerland does, require insurance companies to be nonprofit, or take insurance companies out of healthcare altogether and have the government manage the whole thing. Medicare for everyone. In the end, there are a lot of proposals and even more opinions. But what they all have in common is expected value. And as always, Mathalicious is here to help you understand the math behind real-world issues like these.